Wonder Woman, Wonder Woman. All the world is waiting for you and the power you possess. In your satin tights, fighting for your rights, and the old red, white, and blue.
Welcome to Chapter 7, The Vitamins.
Vitamins D, E, and K by Professor Tammy. Learning objectives. Discuss the roles of vitamin D, its food sources, and the effects of its deficiency and toxicity. Discuss the roles of vitamin E, its food sources, and the effects of its deficiency and toxicity. Discuss the roles of vitamin K, its food sources, and the effects of its deficiency and toxicity. Vitamin D is not an essential nutrient. That means you don't have to consume food that have vitamin D because the body can synthesize all it needs from using sunlight. So by having sunlight, your body can synthesize vitamin D. Vitamin D is estimated deficiency prevalence. Calcium is regulated, acts at 3 locations to raise calcium level. Other roles of vitamin D are hormones. It acts at the genetic level, and there are hints from research about the different roles of vitamin D. So if you look at this picture in the middle, it's a deficiency of vitamin D. It's called rickets. Vitamin D is recommended to prevent rickets. So this child has bow-legged. So sometimes they're called parentheses because they look like parentheses. So, because the weight of the child is heavy, the body of the weight of the child is heavy. So that's why the legs are bowed. It's weak, so the weight kind of settles over it. Osteomalacia also is due to the deficiency of vitamin D. And osteoporosis as well. Some groups be concerned of vitamin D deficiency, especially for osteoporosis, would be white women, Asian women, Hispanic women, or people with genetic history of osteoporosis. And vitamin D can be a most potentially toxic vitamin. Vitamin D increases blood calcium concentration, which can cause kidney and heart failure. You don't want to have too much vitamin D. Ultraviolet rays help with the cholesterol compound, the role of the liver and kidneys, and also it deals with the skin pigment because the darker you are skin-wise, you synthesize vitamin D slower when you're in the sun. But if you have lighter skin, fairer skin, you synthesize vitamin D more quickly. There are factors that interfere with vitamin D synthesis, and we'll be talking about that soon. There are some factors that affect vitamin D synthesis, like advanced age. When you get older, the skin loses some of its capacity to synthesize vitamin D. Air pollution, particles in the air, it kind of screens out the sun's rays, kind of blocks it a bit. City living, tall buildings block sunlight because of the shade. Clothing, most clothing blocks sunlight, but if you're wearing thinner clothing, the sunlight can go through it. But if you're wearing thicker clothing, if it's knit closer, then it might block out some of the sun. Especially there are some clothes that are more UV protected. There's some kind of coating over the clothing too. Cloudy skies, heavy cloud cover can reduce sunlight penetration, but it doesn't mean that you cannot get sunburn, because sometimes the sunlight does reflect on the clouds and it hits your skin. Geography: sunlight exposure is limited. So in October through March, at altitudes above 43 degrees, most of Canada and Alaska, and November through February at latitudes between 35 and 43 degrees, many U.S. locations, and then locations south of 35 degrees, much of the southern U.S., direct sun exposure is sufficient for vitamin D synthesis year-round. So it depends. Like if you have longer days, then you can have a better chance of getting vitamin D. But if you have longer nights and short days, because it depends where you live in the United States, there's more darkness, you're not going to be exposed um, with vitamin D as much. Imagine you live in Barrow, Alaska. It's not true that there's 6 months of no sunlight and 6 months of 24 sunlight. I used to live in Alaska myself. Well, in Barrow, Alaska, really it's 3 months of no sunlight and 3 months of full sunlight, and everything is in between, because as the seasons change, like the first day of Barrow, Alaska, when they don't have sunlight, it'll be in the Alaskan radio, and the first day they have light after 3 months is also going to be at the radio. It gets all exciting. You should read the news sometimes. It's really cool. Homebound. Someone who's living indoors, and they don't really see the sun, don't get any sun exposure, they're home, staying home, or, also bed-bounded. Seasons. Warmer seasons of the year bring more direct sunlight. Yeah, like summer. Skin pigment. Darker skinned people synthesize less vitamin D per minute than lighter skinned people. That means that if you're darker, you get to be in the sun longer. When you're lighter, you gotta be careful, especially when it's hot. You cannot be in the sun as long as someone who is darker. Don't want to get sunburn. Sunscreen. Proper use reduces or prevents skin exposure to the sun's rays. So if you use your sunscreen every 4 hours, when you reapply, then you're not getting all the vitamin D you need, but you're also preventing sunburn. We did sunscreen already. Oh, time of day. Midday hours bring maximum direct sun exposure, because the sun's, up there, not much shadows, especially if you're in the city, and, versus if you were to come out at 10 or at 3, then there's shadows in the streets. Vitamin E. Vitamin E is a fat-soluble vitamin made of tocotrienol, which is a biologically inactive form of vitamin E, and tocopherol, which is a biological active form of vitamin E. So the functions of vitamin E are primary role is an antioxidant. And also vitamin E protects polyunsaturated fatty acids. It protects low density lipoproteins, LDLs, and its recommended dietary allowance is 15 mg alpha tocopherol per day. The tolerable upper limit is 1000 mg per day. The sources of vitamin E are vegetable oils, nuts, seeds, wheat germ, soybeans. Animal and dairy products are poor sources of vitamin E. So you're wondering, free radical damage and antioxidant protection? So let's look at this, the first one. Free radical cause chain reactions that damage cellular structure. So number 1, here's the oxygen-free radical. A chemically reactive oxygen-free radical attacks the fatty acid, DNA, protein, or cholesterol molecules, which form other free radicals in turn. Number 2, This initiates a rapid destructive chain reaction. It's almost like dominoes, right? And then number 3, the result is cell membrane lipid damage, cellular protein damage, DNA damage, oxidation of LDL cholesterol, and inflammation. These changes may initiate steps leading to diseases such as heart disease, cancer, macular degeneration, and others. So let's look at this other one. Antioxidants quench free radicals and protect cellular structure. So here's the antioxidants. Antioxidants such as vitamin E stop the chain reaction by changing the nature of the free radical. So here's a little snapshot of vitamin E. So I know we spoke about vitamin E before, so let's just look at this. The chief function: antioxidant protects cell membranes, regulates oxidation reaction, protects polyunsaturated fatty acid, deficiency, red blood cell breakage. Oh, sounds horrible. And nerve damage. Toxicity is arguments that affect an anti-clotting medication. So here are some good sources of vitamin E: safflower oil, wheat germ, mayonnaise, canola oil, and sunflower seeds. Vitamin K. The roles of vitamin K are blood clotting, bone proteins. Deficiencies are, you want to make sure your newborn baby don't have vitamin K deficiency. So a lot of times they're giving the shot vitamin K before they leave the hospital as newborns. And here's some information about vitamin K through the CDC website. And as far as toxicity of vitamin K, if you have too much, you can look jaundice. What is Coumadin? What does it have to do? Let's just say you're taking the medication Coumadin. It's not like you cannot take vitamin K products, but it does the opposite effect from vitamin K. Vitamin K helps blood clotting. Coumadin doesn't. So you're having like vitamin K say, I'm going to clot the blood, and then Coumadin saying, no, I'm not. So how can you avoid? Like, you cannot say, oh, totally cannot have vitamin K. Maybe you have just a little bit. It happens to be in your food, but you don't purposely going, yum, 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 yum. I'm going to eat all these food that have vitamin K in there. Here's a snapshot of vitamin K. The chief function is synthesis of blood clotting proteins and bone proteins. Deficiencies: hemorrhoids, abnormal bone formation, and the toxicity opposes the effects of anti-clotting medication like Coumadin, like we mentioned. So some of the good sources of food with vitamin K are cabbage, spinach, soybean, kale, asparagus, and green salad greens.
See you soon. And remember to read the book.